Hey guys, welcome back to Medical Coding with Blue. It is Q&A Tuesday. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Every week I take some of the questions that have been asked by viewer comments through emails and from Instagram, and I roll it all into one episode to give you guys the #1 question and answer show about medical coding airing on Tuesday. So if you would like to have your question answered for a future episode, I hope you'll comment below or send me an email. Thank you to everybody who submitted their question. Let's get started. All right, first question. Can you make a video about how to identify correct code and fast? So there's a couple of ways that this question could be interpreted, right? So I asked for clarification because I'm a coder and that's what I do. So I said, are you asking me to make a video quickly about how to identify a correct code selection? Or are you saying, how do you identify a correct code to select quickly? So the viewer responded, I am preparing for the exam, so I requested you to make a video about how I identify the correct code faster during the exam. If you do, it means it would be really helpful. So here's the thing, I can't really do videos on demand because I already have a schedule set up that's 2 months in advance. So right now I have shows all the way for 2 months, okay? So because of this, that's the way I do my schedule. And so doing videos on demand doesn't really work because it messes with the schedule. If you really need something, a particular topic, you can browse through my videos or you can ask me and I can recommend videos for you. If that doesn't help, then you can book a one-on-one session with me. I do offer tutoring, one-on-one tutoring, and I also offer professional coaching. So if you're interested in that, I do leave my rates in the description box below. It's very reasonable. It's $25 for the first hour, $15 for the second hour of the same session. So if you're interested in something like that, you have to have something like right now. That would be something that I would recommend. Either go through the videos or book a session with me. So that's my answer on that one. Next question. If I do independent study to learn medical coding, do I have to purchase the books needed to sit for the exam? Absolutely. You do have to have those particular books that you need, your diagnosis book, your procedure book, the HCPC book. You have to have those when you are going to go sit for your examination. So yes, you do have to have that. Next question. Hi, I enjoy your videos. I learned so much from them and they're very educational. I am interested in a medical coding program. I was thinking about online, but I see that a couple of coding programs are offered through the National Healthcare Association. Do you know if this is an accredited online program that is being offered through the National Healthcare Association? So I'm not really sure what credential this viewer is looking at, but if you are looking to be a medical coder or a medical biller and coder, you have to be certified with the American Health Information Management Association or the American Academy of Professional Coders, either one of these associations, because these associations and their credentials are what employers are looking for. As far as this other National Healthcare Association, I don't know about them. I know that they have a billing certificate, if you will, but you do not have to be certified to be a medical biller. A lot of people think that if they have some sort of credential on their name, that it'll help them to get in. You have to have the right kind of credential and the right kind of letters after your name in order to get in. And when you are looking for a medical coding position, they are looking for AHIMA or AAPC credentials. You can find that out by just looking at the job listings in your area if you're looking to be a medical coder. So I would strongly recommend that you continue to do your research. I have plenty of videos that I talk about beginner credentials for medical coders and all kinds of FAQs about starting and how to get started. I do leave the playlist in the description box below. So if you're interested in that and you're beginning your journey, please go through those videos because there's so much information in there that will help you in the beginning of your journey. So next question. Do you have any information on inpatient pre-employment assessment testing, like the exam setup and what kind of questions are asked, is it multiple choice, etc. So when it comes to how different facilities set up their pre-employment exam, it is completely on the facility. So every place is different. I have interviewed with places that the questions were 25 questions and it was just a mix. And that I'm doing the outpatient side, so I'm assuming that the inpatient side would be similar. And I've done ones where there was 50 questions. I've had tests that were 100 questions. So it really all depends on wherever you're applying and whoever is designing their test. So that's why I always tell you guys, even when you are looking for a job, you still need to make sure that you're staying up on how to code in your coding skills, because when you pass your certification exam, it may take you a while to find a job, but you still have to make sure you know and you remember your skills. Don't forget your skills and don't stop practicing coding, because of the simple fact that it's going to make it a lot easier for you when you try to get in. So that's my advice there. Be prepared for anything, essentially. Next question. What can you tell us about the CPC exam? I heard that it is heavy on the guidelines. Okay, here's the thing. You can find out about the CPC exam by going to the AAPC website. The AAPC website has a whole outline of everything that is on the test. So whenever it comes to asking what is on the test or whatever, go directly to the association website itself. So that way you're not listening to hearsay. And that's the thing that I would caution a lot of people on, especially if you've just finished the school and you're getting ready to take your certification exam. And, sometimes people will go around asking people, well, what did you think of the test? Was it hard? Was it this? Was it that? What was the concentration of it? It's going to be different for every single person, and every single person's thought process on if it was, heavy on this or heavy on that is going to be different. So this is why I'm telling you guys, whenever I see I heard, go directly to the association website, find out directly from them what is on the exam, and go that way, and don't listen to hearsay. So that is just my advice on that. And again, I'm not even certified with AAPC. I'm certified with the American Health Information Management Association, AHIMA. I get so many questions from AAPC folks. AAPC, hey man. But, I'm happy to answer, because to me, I find that there's good coders in both associations. So again, I'm not a coder snob. I mean, like a credential snob. So you guys really should look on the website if it's like specific questions like that, for like what's on the exam, what to expect. Both associations have it. They have a whole outline of their exams. So that's my advice. Next question. What was the test like for you? Oh, so for me, well, I mean, of course I was nervous when I took my test. I mean, everybody's nervous. But the thing about me is I spent a lot of time studying. And this was for hours, that I did it. I mean, hours I was doing it. Every moment I got, when I came home from work, I would go and I would start studying, because I really wanted to pass this exam. I had heard a lot of people had failed, and to me, when you hear that, it just sort of, for me, it lights a fire even more. And I'm like, okay, I really have to make sure that I'm on top of my game. There was 34 people in my class, and I was the only person who passed the certification exam the first time. So it really does take a lot. And for me, it was a very, the time just freaking flew. Like the whole time I'm in there, I'm just like, I gotta hurry. And the thing that I would advise is that to go with your first instinct. So many times people will get hung up on second guessing themselves, and they'll be like, should I? Those precious minutes are going by, because for some reason, when you are in a testing center, it's like warp speed. So my suggestion would be to go with your first instinct. If that's, if you're at the testing site and you're trying to figure out, what you should select, what you shouldn't select. Guys, I mean, you're going to be able to get a certain amount of number wrong, right? But for the most part, you got to be able to get through that exam. Okay, so that is my advice on that one. And everybody's opinion on it is different. Some people are more relaxed than others. I did stop studying about a few days before my exam, because my mom was like, you have learned everything that you're going to learn. Now's the time to just relax. And that's exactly what I did, because cramming has never, personally for me, like when you're studying, it never helps. Like cramming never helped me. So that is what I learned. And even like I said, right before, a few days before, my mom was like, stop studying, because you got this. You're not going to learn anything new. You're not going to memorize anything at the last minute. So now it's just a time to just relax. So I did. And then when I took my exam, and then when I came out, they gave me my results and I passed. So that was very, very exciting, and I was very, very happy. So that's just my experience. Next question. Hi, Blue. So I was in school and we didn't spend much time on anatomy and physiology. Due to this, I do struggle when reading operative reports. Should I take a separate anatomy class offered by the AAPC, or is this something I can learn on my own? Thanks so much. You can learn it on your own. Some people have to have that structure where they have to go through a program and it helps them. But for the most part, anatomy is the same. They haven't discovered any new body parts. Everything is just the same. So you can literally pick up a book if you are disciplined, right? And you can pick up a book, you can watch videos on YouTube. Again, YouTube is an amazing source of information. And when it comes to things like that, they've got a lot of really good things. But you can, if you want to. Again, it's just more money you're going to be putting out when you can learn it from a book, or you can learn it online. So, I mean, as far as like watching videos and stuff like that. But that is just my advice. But yes, if you find yourself stuck because you're not really strong on anatomy and physiology and medical terminology, then you need to do your homework and start really studying those things. I do have my Patreon channel if you're interested in that. My Patreon channel, I do exercises, I do crossword puzzles for medical terminology and anatomy. Because I recently started doing the word searches for and using the mnemonic devices to help with anatomy, and doing the word searches with that kind of theme. And so I think they're really cool. But anyway, if you're interested in checking that out, I will leave the address for my Patreon channel in the description box below. And so, next question. Where am I? Why do I keep losing my place? Oh, here we go. Do you think it's better to go through an online university or go straight through AAPC? I was looking at their website, but I don't necessarily see that they have classes for medical terminology or anatomy. Am I missing something? Actually, AAPC does have a bundle about that, but it's separate from the coding, so you just have to look for that. But they do recommend that you take that first if you don't have any experience, obviously, that you take the anatomy bundle first, so that way it'll help you to better get to that course. You have to have anatomy, physiology, medical terminology. You have to have that before you start learning how to code, because how are you supposed to interpret the documentation if you don't understand what you're reading? Medical coding is a completely different language. I'm not kidding, guys. This stuff is intense. We have to know what doctors know while never having gone to medical school. That is what I always say all the time, because we have to know about the body, the disease process, and we have to be able to understand this medical terminology. If medical terminology throws you off and it's not your favorite subject, I always recommend trying to work on learning your prefixes, your suffixes, and your root words. That is the best way to learn medical terminology, because you're not having to memorize hundreds of thousands of words. You are memorizing, or you're trying to learn prefixes, suffixes, and root words. That way you can piece together bigger words and it's going to make a lot more sense a lot more quickly. So that is my advice on that one. But yes, absolutely, you can study on your own. If you feel like you need the program from AAPC, go right ahead. Okay, next question. Blue, in addition to asking coworkers for help, have you used or do you recommend professional forums for general coding questions or for help with a specific chart, maintaining confidentiality by omitting any PHI from the question? For instance, AAPC's Supercoder Forum. Okay, here's the thing. When it comes to who I ask and the resources that I use when I need clarification on something, it goes like this. If I can't find it in my resources, like by looking in the Merck manual, by looking at a coding clinic, by looking at the book itself, by looking on YouTube to see if there's anything in specifics that I can find, or by going to one of the websites that I frequently use, like orthoinfo.org, because I'm an orthopedics coder and I code for orthopedics and podiatry primarily right now. That website I love. This is not an ad for them, but it is so freaking awesome because there's so much information and it really does break things down in layman's terms, which is very helpful. So I will go through all of these things first, then I will ask my friend, my one and only friend that I will ask questions about medical coding to. I try to keep it as clean as possible who I'm asking, because when you start getting a lot of feedback from different places, you don't know what their background is. I have seen some of these forums, not necessarily Supercoder, but I have like typed in questions into the internet and looked and seen some of these forums that pop up, and I'm thinking, oh my gosh, that is completely wrong, because it won't be related to my question, but I'll see it related to something else, and I'm like, that's wrong, but I can't comment because it's just like it's a closed forum, but I can see it, but I just can't comment. So it's just like, okay. So you can't always trust what you see in those forums. You can't always trust what you hear from somebody else. So this is why I always go through my own little personal checklist of all of these resources before I go and ask somebody, which is my friend that I'll go and ask. Because I trust her and I trust what she says. She's an excellent researcher. She knows. And again, when it comes to asking people questions, for me, I have to know and trust the person. The person has to be as smart as me or smarter than me. That's the way I look at it, because I never want to ask somebody that is just, well, it's like this because I say so. And you will find that sometimes in medical coding. You'll find some coders that are like that are very, very firm in their beliefs and why they believe it is a certain way. But that is their personal interpretation. And sometimes, occasionally, it can be wrong. So it just depends. But again, that's why I say I go through all my own little personal checklist before I go and start asking other people. Sometimes you can find helpful information in those forums. It just depends. I have seen some responses in some of those where they do cite their source, which is wonderful. And I think that's exactly the way that they should be doing it. But again, it just depends on the individual. But yes, that would be what I would recommend. So using your resources, finding somebody that you can trust to ask, and if it all fails, then go to the provider and ask the provider to clarify, or ask, can you please explain this? Because like I said before, a lot of times they will be happy to answer, but of course you can't always be running back and forth to them asking questions like that or whatever. But if it will help you to understand a little bit more on what proper code selection to get, that's something different. So that's just my advice. And the last question. Blue, how often does a medical coder get dinged on an audit for a code selection that is later, after discussion and presentation of official resources to justify the coder selections, recognized to be the correct code after all? How often do situations arise in which the guidelines don't clearly point to one correct answer such that a judgment call must be made. Okay, so a couple things here. The first thing is, how often does it happen where the coder gets dinged and then the coder presents their information and then it turns out that the coder was correct? It happens. It just depends. The auditors are human too. They make mistakes too. And sometimes they may not like when the coder comes back and says, well, no, actually it's this way. Everybody's experience level is different. And sometimes even auditors have to be like trained because sometimes they don't know something. And a lot of times if the coder is not strong enough to stand up to an auditor, sometimes they'll think, okay, well, the auditor said it was wrong, so I have to fix it to where they say. The auditor should, in theory, be able to explain why they came up with that code. They cannot just say, because I said so. We all fall under the AHIMA standards of ethical coding, which tells us that we have to speak up if we see incorrect coding. Doesn't matter who it is, all right? And of course, I'm paraphrasing that. But when we see our coworkers giving the wrong information, we do need to speak up. And that is very, very important because it speaks to the integrity of the codes that we are selecting, okay? You have to be able to show how you got your answer. That's number one, with a reputable resource. It can't just be, well, I feel that it's right, and I feel that the auditor is picking on me. It's difficult because sometimes egos can get in the way. Either it's the ego of the auditor or the ego of the coder. And this is where you have to be, as a coder, you have to be humble and you have to be able to say, well, I know that I was wrong. If you know you're wrong, if you know the auditor is correct, and they're able to show you how they got to it, then you need to stop arguing and say, okay. Because I have seen and heard from coders many times who said, well, I don't want her to be right, so I'm going to continue to argue until I get my way. It doesn't work that way, okay? Number one, that's not the way to be, all right? Number two, there's going to be times, it's a win-loss thing. There's going to be times when you're going to be able to beat what the auditor said, right? And then there's going to be times when the auditor is going to beat you. So it just depends, and it goes back and forth. This is why understanding the coding guidelines, understanding your anatomy, physiology, medical terminology, and the disease process is all going to help you become a sharper, high caliber medical coder. These things take time though. So there's going to be times when you're going to get a ding and you're like, really? How did I miss that? How did I not see that? It's going to happen, guys. I'm telling you, because it even happens to me. Sometimes I'm like, what the heck was I thinking? You know? And then sometimes I'm like, no, it's this way because this, and this. And then my supervisor would be like, yes, but, and she gets very excited because she says, Bleu, you're like one of the only ones who will sit there and bring me all of your resources and say, this is why, this is why, this is why. And I'm like, I have to bring my A game. And so whenever she gets this, like, oh, wait, she told me, look right here. And I'm like, oh, so, you know, we have a pretty good relationship when it comes to that because it's a very good challenge, right? That we both give each other because, you know, she knows that she has to bring her resources. I know I have to bring my resources. So when you have two people like that, we've both learned from each other. I'm just saying. Anyway, when you do things like that, when you have a really good relationship with your auditor, when you're able to have those good conversations, that's when people learn. That's when the elevation of knowledge grows because you're learning from each other and there's not that because I don't want to be wrong, so I'm going to continue to argue. Don't be like that, guys. You won't grow if you do that. And the only person that you're hurting, not only yourself, the provider, and the patient. The patient should always be first in your mind. If I'm coding this wrong, I'm hurting the patient. That's the way you should think. So that's why you should always strive to do it correctly. You know, that's my advice on that one. Yes, there are some guidelines that are a little, and you're like, you know, But that's when you can look in the coding clinics and see if there's anything that you can find in those coding clinics. And it's the AHA coding clinics. So that would be what I would recommend on that. But yes, it is going to be about that. And it does happen sometimes. Auditors will catch you on something that they think that you did wrong, and actually you were right. So it just depends. Everybody's human and we all have our days. So I'm going to go ahead and wrap this one up. Thank you so much for joining me. I hope you guys enjoyed this episode, and I will see y'all for the next time. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.